Hello, this is Lumen May, County Commissioner for District 3. I'm here today at May's Message to talk to you about some of the resources that are being provided by the federal, the state, and also here at the county. Some of the things that we've implemented along with my colleagues. One of the largest grants will be the CARES Act. And the CARES Act has almost $1.3 million that's coming down through Community Block Grant. We have $870,000 that will be implemented here in Escambia County, or whether it's for utility assistance, mortgage assistance, meals, homeless services, but we certainly have not worked out that plan, and hopefully in the next couple of weeks we will have that plan in place. But I do encourage you now to go to our website and to look at our COVID-19 recovery grant program. And this $2,500 grant program was being provided by $100,000 from the county, $25,000 from the city, and it's just kind of a grant to bridge until you can get your SBA loan. And so the clearinghouse for that is with the Small Business Administration. But I know that there are a lot of small companies that need help, landscapers, barbers, people who only have one or two employees. And so I encourage you to apply. As you can see at the bottom of the screen, you can go to that website and you have to apply digitally. But if you're having problems with that, please call our office and talk to Ms. Carla Thompson at 595-3123. Carla is administering the grant. She cannot fill the grant out for you. She cannot provide the documents, but she certainly can guide you in the right way. You'll have to look back at your tax returns, your 2018, 2019 tax returns, your quarterly reports, your balance sheets, and those are some of the things that she can guide you in and help you to be able to provide that information, because we know that there's going to be more need than resources. But I certainly want to get out front and help the constituents, particularly those that I represent who may be suffering. And because we know that we were facing some tough and difficult times, but we here at Escambia County, we want you to know that we care. One of the programs that I started as a commissioner was Escambia Cares, and during this terrible time and these challenges that we're facing, we want you to know, I want you to know that there is a commissioner that's fighting for you, that loves you, understands that we are all in this together, and we have to restore our economy, we have to return our revenue, but more importantly, we have to be safe. So today, Dr. Greer Hall and Dr. Sandra Donaldson are joining me, so you will be safe, because if you can maintain your health, you will be able to one day recover your revenue. Thank you, and God bless. I'm joined today by virtual meeting communications with Dr. Greer Hall and Ms. Sandra Donaldson of Community Health. They're both here to share some very valuable information as it relates to COVID-19 and the coronavirus. As you know, we've set up the testing site at the Brownsville Community Center, and testing site in Cantonment, but there's still information that needs to get out to our community. And so please sit, listen, share this information with others, because it's valuable and it can save a life. Welcome, Dr. Greer Hall and Ms. Sandra Donaldson. Welcome.
Thank you, Commissioner May.
Thank you, Commissioner May.
Well, I'm very thankful that you took time out of your busy schedules to be here. So we're going to get right into it. And Dr. Hall, I just really want to get your insight on how do you feel we're doing as a community when it comes to slowing the spread of COVID-19 here in Escambia County.
Well, I'm glad you asked that question, Commissioner May. I think we are doing a very good job to slow the spread of COVID-19 here in our county. First of all, we're testing, and these testing sites that we have available are valuable, because without knowing who has the virus, we can't do anything about it. But by knowing and providing these free tests for our citizens, we are doing an awesome job at getting that service out. We're also social distancing. We're doing that right now as we speak, and I'm so proud we're doing more of this. And I see people wearing their cloth masks when they're out at the store, when they're at work. And so that is very, very important to continue to do. And also, we are getting the message out and educating our people by providing messages such as this one. We still have venues that are closed as far as schools, and that's going to help prevent the gatherings that we don't want, because whenever we have more than 10 gather, then we're going to have the spread. We can definitely have the spread. And I see more churches are also doing virtual services, and this is encouraging. So I'm seeing a lot of things that are being done here in our community, and I think as long as we continue these measures, we are going to continue to decrease the spread of COVID-19.
Thank you, Dr. Greer. And another question that I would have. I mean, obviously, there are some people who are more vulnerable to this virus. We know that adversely across the country, neighborhoods of color, particularly those in African American neighborhoods and poor neighborhoods, are more at risk of the complications. And many times we see that they are experiencing many difficulties. Can you elaborate on that?
Yes, and those who are age 65 and up, those who have any kind of chronic health condition, lung disease, heart disease, obesity, anything as far as immune deficiency, cancer, those patients are at a much higher risk of the severe complications of COVID-19, and those complications can include pneumonia, respiratory distress, and even death. But we are seeing, and we said it the very first time we met, this virus does not discriminate against anyone, but we are seeing an alarming number of African Americans who are catching COVID-19 and who are succumbing to the complications, including death. So, this alarming number of African Americans is something we really need to address and be aware of. And we want to make sure our community knows this is happening. We have 26,000 deaths nationwide, and we know that number is going to continue to increase, but we need to really focus on those who are dying. And this, by alarming numbers, is our African American community. And they are 2 to 3 times more likely to die from COVID-19 than any other race. And this is alarming, and we need to do something to address it, Commissioner May.
Dr. Hall, I ride through and we'll see young people congregating in the parks and playing basketball and not practicing social distancing. Would you just quickly address how you can be asymptomatic and still take it home to grandma and granddad and mom and dad and not feel sick at all?
Yes, and that is so true. A lot of patients with COVID-19 have no symptoms at all, or they have very mild symptoms. They think it's just their allergies, or they think it's a cold, but they may not have the complications, but their parents, their grandparents, their family members, and co-workers can succumb to those major complications that I already discussed. And so this is something we need to, take in mind. And it could be your neighbor, it could be your family member that you take it home to after you have congregated. And there are other reasons that Sandra Donaldson can explain why African Americans are more at risk for this disease, unfortunately.
Thanks, Dr. Greer Hall. And Sandra, that leads us right into the question with you. We really would like for you to expand on the answer that Dr. Greer Hall had just spoken about. So can you give us some more information on what can we do individually, as a community, collectively, to decrease the spread of COVID-19?
Thank you, Commissioner May and Dr. Greer Hall. I'm going to piggyback right off of Dr. Greer Hall, and I want to first just illustrate as healthcare leaders what we are doing in our communities. Well, we have been working with our pastoral leaders to engage in opportunities to work within the guidelines of social distancing. We have worked with our elected officials, such as yourself, Commissioner May, to ensure that there is access to free COVID testing. Local businesses have taken strong stances on protecting their staff and customers. And so we have to make sure that we follow the guidelines for social distancing, also known as isolation, because some people get confused. They think they're in isolation only when they go in the hospital. But it has been proven to be the most effective weapon that we have in reducing the spread of this deadly virus. The cities of Chicago, New Orleans, Las Maryland, and South Carolina are now amongst the states that are reporting data based on race. And it shows an alarming rate of victims who are Black. So we must prevent Pensacola from falling within those statistics. We must be vigilant in maintaining social distancing, not only to protect ourselves, but those we love. Once tested and positive for COVID-19 and you have to be hospitalized into isolation, that means that no one in your family can come and visit you in that room. And I could not imagine my loved one or myself having to fight this deadly disease alone. So we just have to remember to protect ourselves and make sure that when we leave our homes, we do have our masks and make sure that we wear them when we're in groups. The stay-at-home order may very well soon be lifted, but we must still practice social distancing and hand washing technique. That's the only way to protect ourselves from this deadly virus.
And of course, being African Americans, I'm going to piggyback on what Sandra says, we are at risk for having chronic conditions. We are at risk for, and there are those diseases that are very, very significant in our culture: diabetes, heart disease, and we have to, keep that in mind. We're at risk for these diseases that puts us at risk. We are sometimes those essential workers who are out and about still working. We are the ones who will wait till the very last minute before we go get health care. And sometimes we don't have the access to health care. And that's what puts us at higher risk for complications from this disease. So there are some social economic determinants, unfortunately, that we as a race have. And it's not something that we can do. We can't change our race, but we can make changes in terms of what we do to prevent the spread of this disease. But we have to keep those things in mind, that we are at higher risk, and we have to take these measures seriously. We need to take this disease very seriously. It can kill people, and we don't want it to kill anyone else, but we definitely want to do what we can to decrease that spread of the disease.
And Dr. Drew, we do understand that people feel that they are stuck in the house and they can't get away and they can't communicate. But just as the three of us are doing today virtually, we are still interacting socially, but physically we're a distance from each other because we're practicing the stay at home that the governor has put forth, the recommendations of the Center for Disease Control. And so, I mean, what would be the encouraging words to those who may want to venture out, but we know that they shouldn't?
This too shall pass. This too shall pass. Spend more time with your family. Spend more time with your loved ones while you can, because typically we're at work and we don't have enough time to spend with them and doing homework with them and schoolwork with them. But this too shall pass. We have to be patient. We just must remain patient, and know this too shall pass. We just have to remain calm, collected, focus on what the goal is. And the goal is to get past this without losing any of our loved ones. So this will pass. Stay very, continue to pray, continue to spend time with your loved ones, continue to communicate through these types of measures, such as we're doing today. But just know this will pass. We just have to remain patient as a people. And I know that's hard to do. I know it's hard to stay in the house, play some board games, do some exercises in the yard. You can take a walk outside. We're not saying you can't go outside your door. Do some other things that you might not have had an opportunity to do, but now you do have an opportunity. So see the glasses half full. See the silver lining. There is one. We will make it through this, but we have to be smart as a people and adhere to these measures that are in place, because it's for our safety. It's for the safety of all of us to do this.
Dr. Gray, you said it perfectly. And what I'd say to our friends who are watching us virtually and picking this up on our Facebook or on our website, be prayerful. We are all spiritual people, and we certainly are believers. But we want you to be prayerful, but we want you to be mindful, but we want you to be aware that this is a deadly disease. The same thing that's happened in New York, in Detroit, New Orleans, Chicago, Mobile can happen here. And I think
Yes.
that because of the aggressive and progressive actions of healthcare officials like the two of you, we've been able to slow the spread and not have as many deaths. And so some people don't believe that it's real, but they don't realize, Sandra Donaldson, Dr. Greer Hall, a month ago, we got together and implemented a plan that's really working, that I believe that when the story is told, people will look back at this community and saw that there was leadership that proactively engaged to make sure that we contain the spread of this disease.
And thank you, Commissioner May, for being one of those leaders in the community and for bringing this to attention, because we do need strong leaders, and we appreciate what local government officials are doing to help with this and to spread the word and to educate our people. So thank you for providing this forum for us.
Well, thank you. I've certainly, you and I have gone closer, and I've learned so much from you. And just as a side note, to thank you for going through the struggles of being an African American medical professional, a doctor. And so I know that the young people who have been volunteering, and some of our younger staff at the Brownsville Community Center passing out food, even my daughter, they are amazed and they admire you. And thank you for this service. And we want people to come see you, but we don't want people to come see you with COVID-19 or the coronavirus. You have levels that you need to get to. And so we appreciate you, Dr. Greer Hall. Sandra, you were the person that initiated with me to setting up the testing site, and so we know your passion. And so as we get ready to close, are there some recommendations, some closing words, or some passionate things on your heart that you want to share with those who are with us today virtually?
Well, I know that a lot of our younger community and African American community, they don't necessarily feel like they can be exposed to this disease. They may feel like they're indispensable. I know when I was in my 20s, I felt like nothing could stop me. But we have to realize that despite the fact whether or not it affects us and we are healthy and we're able to fight this disease, but we have to think about our families. We have to think about the folks that we're in direct contact with that we love, like our grandparents. And our grandparents may not be able to fight this disease. Right. So we have to be very vigilant in being able to take a stance as a community overall to be able to stop the spread of this deadly virus, and we can begin to live our lives as normal again.
Absolutely. And I would say to parents, our children are our responsibility. We cannot allow them, just because they become irritated or frustrated and want to leave the house. We have to talk to them about the health. And as Sandra has just said, we all felt like we were invincible at a certain age in our life. Young adults, teenagers, they need older adults. They need leaders to tell them the truth that this disease kills. And so please share this, share the information. Don't congregate. The Center for Disease Control, they have spent billions of dollars on research and researchers and the outdoor hygienists, the epidemiologists, the healthcare professionals like Dr. Greer Hall. They are saying stay home. And if you stay home for a short period of time, we will be able to get back to normal in a quicker period of time. But if we continue to congregate, we continue to have gatherings, we continue to have meetings and spread this disease, it could take Pensacola by storm, and we can lose the ones that we love. We can lose our parents and our grandparents, and that's just something we don't want to do. So I'm pleading with you that are watching. I'm pleading with you to share this. I'm pleading to listen at Dr. Greer Hall, listen at Sandra Donaldson, those who wake up every morning and put their lives on the line to come and educate and to serve and to protect and to provide health care for those of us. And we don't want to jeopardize our healthcare professionals because we made foolish mistakes by engaging and participating in activity that was unhealthy and beneficial for the community and for yourself. So thank you for joining May's message. Dr. Hall, I'll give you the last word, and hopefully we'll be again with this virtual meeting in a week and to provide some more information to this community. Dr. Greer Hall.
So if you feel like you have symptoms, get tested. It's free. And as of Monday, anyone with any symptoms of COVID-19 can get tested at one of our centers, at one of our sites. So please call, get tested. Know you have this so you can prevent the spread of this to your family and loved ones. And so get tested. Don't be afraid to go and get tested if you have any symptoms. And I encourage everyone to stay prayed up. Thank you so much, Commissioner May.
Amen. Thank you, ladies. Again, get tested. If you call and the line is busy, just keep calling, because it will save your life. Please get tested. Thank you, and God bless.